Hi.
Hi guys, welcome.
Hey everyone. Thank you for joining us for this event today. This is called Chin Up event because we are focusing more on the jawline today, jawline, chin. And I want to see if somebody joined us, how we are doing.
Yes, guys. Make sure that when you hop on, you're saying hey in the comments so that you know, so that we know that you guys are here.
Right.
Make sure that you are tagging friends.
Yeah. Can you hear me? Checking my mic right now. So we just kind of wait a little bit. So make sure everybody is here. So I see Allison is here. Hey, Allison, how are you? And then more people kind of joining in. So we're going to go quickly all our event today. So we are focusing mainly on chin and jaw.
Yes.
Because when we kind of lose volume from our cheek and upper face, we see more laxity in our lower face. So that can be due to aging too, but sometimes it's genetically, some people has really strong mid face and upper face and have like not that strong jawline and chin.
Yes.
So to enhance the chin and the jawline can actually enhance somebody's face profile a lot. And we're going to go in some of the examples like that. So let's go over today's what we are doing, what timeline is. We're doing some spatial. There's a big raffle. So whoever is entered today, who's watching us, I'm going to get some like little gift, and whoever's purchased. And a lot of people purchased so far. We're going to do a big raffle on July 1st. So I'll kind of let you go over that.
Yes.
So if you can show us like our slide, please, for our big raffle.
Yeah, so we have a lot of stuff going on, guys. So as you guys are hopping on, make sure you're saying hi, make sure you're tagging your friends. You guys will be having the $50 gift card go into your account for sharing friends, and your friends tuning in. You guys will get an extra $50. So that's going on like always. We have some really good specials going on right now for our Chin Up event. So some of those specials that are going on is Kybella, which Kybella we can use for under the chin fat. And that special going on right now is buy two, get one free. Threads right now, we have buy one area, get one area free, which I think is amazing. I've never seen that good of a special, so that one's a really good one. Cool sculpting as well. Cool sculpting, we have buy 4 cycles, get 2 free. And then
so we have like fillers on spatial.
Yes, filler. Juvederm filler, which is a fan favorite.
Right.
Buy 2, get 1 free right now as well.
Right. And then so we're gonna like do how to sculpt our jaw. So it's like we're going to mainly focus 4 things. So we can do by volume, and then there's some volume, it means filler. And we're going to focus today more on Juvederm family. So there's special type of filler, which is great for chin and jaw sculpting. They got FDA approval from for the chin filler, that's Voluma. Voluma is used for like a lot of time, and we use it in cheeks a lot. And so we're giving like adding the volume where we lost the volume, and the laxity, we don't have good solution, which we see like immediate result and minimum downtime because it's a minimally invasive procedure. So kind of a picking up the skin and sharpening your jaw where the threads come in. So that is another like topic we're going to discuss, and we have some before and after all like all of those to kind of go over. And sometimes we have extra volume underneath our chin. We call it submental fullness. Right. So we have 2 ways to deal with that. For non-surgically, we are focusing on today. So coolsculpting is another great way if people don't want any downtime. And the Kybella is quick and easy. Within 5 minutes, you are in and out. But then it takes like lip swelling is there, and it takes 3 months to see the results. In coolsculpting and Kybella, both you have to wait a little bit to see the result. And we have our lovely guest here today from Elastin.
This is Annie.
Yeah. So,
Hi.
so
I'm a nurse educator with Elastin Skincare. So I'm going to be talking a little bit today about our products and how they work with the procedures that they do here in the office.
right. So Annie is going to go in a minute. She has a little PowerPoint. So about the product, we carry some of the Elastin product, which is one is the great goes with cool sculpting. Our patients loves it. So that kind of a with the fat loss, we have some skin laxity on our body. So that's a great product we use, and the nectar, which we use pre and post procedure. So we'll kind of go ahead and let Annie go over that real quick. So I'll give her 5-10 minutes to go over, and then we're going to go going to talk about our lovely patient, which she's not here right now. She's going to come here, so we're going to inject her, and I'm going to show her what my planning is, what consult I'm doing, why I'm doing what I'm doing, so you guys can see and have more idea. So I wish I can show all 4 modalities today, but we probably won't be. So we're going to focus only on filler today. And we have great support from our Alargan rep. So that was great.
Yes.
So, okay. So it goes to Annie. So Annie is going to talk over about her products, and we're going to show the presentation. Sometimes we can have some technical difficulties, so sometimes it's hard to show things. So, but
so for you guys that don't know, the products that we've added into our practice from Elastin, we've seen great results from. We absolutely love them. Definitely for me with the cool sculpting, the body transforms amazing. Like Dr. Mira was saying, it helps a lot with the elastin. It helps a lot with crepiness looking, and then it works really well when you're pairing it with a treatment like cool sculpting or thermi body, just because it helps kind of break down that fat and kind of helps push it out. And then the other one is the nectar, which has been really, really good as well for after laser treatment. So all of you guys out there who love your BBLs, micro laser peel, anything like that, this is really good pre and post. And we are really loving it and seeing great results.
Yeah, so I'll go to Annie. She's going to go over our products, and she's going to talk. Go ahead.
Are you able to see these PowerPoint slides on the screen?
Yes, so they can hear you, and then they're going to see the PowerPoint.
Okay, perfect. Well, if you can go ahead and skip to the next slide. Part of as we age, as I'm sure that they have discussed with you here in the clinic, part of what happens as we age is we're breaking down our collagen, we're breaking down our elastin, and you see it on the surface as wrinkling and crepiness. But if you kind of look, go ahead and click another slide, please. Down into the dermis, you can see when we're young, you have nice, healthy collagen elastin that gives our skin support. But as we age and as we have sun damage, it starts to break down, and we no longer have that support and structure to our skin. Can you click? And so what it looks like, you can see with an electron microscope down into the skin. At the top, you see nice long strands. That's our collagen elastin strands. That is a very healthy situation where we can regenerate new collagen and new elastin with the devices and the skin tightening procedures and with our skincare. But the problem is, if you can see down at the bottom, you see all those broken down strands. That's actually sun damage and aging that's going on in the skin, and it kind of builds up like a graveyard of proteins in the skin. And so what this line does with elastin, we go in and sort of remove or almost debride all that old damaged stuff out of there, so that it's like weeding the garden before you plant new seeds. So you make room for the new stuff to come in. Can you click ahead? So if you can see here on this slide, the old collagen and old elastin in this biopsy, down at the bottom, the dark pink, You can see that has been removed with our technology on the right. It's replaced with new healthy collagen and elastin. Go ahead and skip ahead. And this is also, skip ahead. You can see in this slide, this is actual new elastin fibers forming, and that's what gives you the tightness and the snapback to your skin. So you can see a whole lot more brown in the skin. That's going to tighten that skin back up. Can you skip ahead? Go ahead. So in this video, you'll see what this line does. What you're seeing here is the clumped up purple is your old collagen. The elastin that looks like wilted palm trees is our elastin that's been damaged. And when you use our technology, can you click play? You'll see these little peptides will penetrate down. They stimulate the little Pac-Man eating macrophages in our body to clean out all that old damaged collagen and elastin, and then it starts to rebuild new collagen and new elastin, and the skin starts to thicken back up and get very healthy and regenerate. Okay, can you skip ahead? So skip one more. So the main, one of our main facial products is the Restorative Skin Complex. Skip ahead. And what you can see here is what it's able to do just with topical alone is really help with the lines, the crepiness, some of the deeper wrinkles, because you're creating the mattress back to the skin, but also that snap back and tightness to the skin. Skip ahead. And if you're using our Regenerating Skin Nectar, which is for pre and post procedure, skip ahead. Skip ahead. Well, we lost a slide somehow, but it's going to help clean out all that old damaged stuff prior to your procedure, and then using it after, you're going to heal much faster and it's going to optimize your results. And then lastly, they also have the Transform Body treatment here that's going to help not only do what the facial products do to create collagen and elastin to help with tightening that skin back up, the skin laxity and texture, but also, next slide. You can see here that using the Transform Body treatment versus using Cetaphil, when you have CoolSculpting, you can see here at 5 weeks on the left-hand side, 162 centimeter volume loss versus 75 with using Cetaphil as the control. So you start to remove a lot more fat quicker, and also you're going to tighten that skin up and help with the laxity and crepiness. Okay, sorry. Thank you so much. I went a little over my time.
Yeah, it's okay. That's great. Thank you so much for your input. And if you have any questions, please feel free to ask on our screen. And I would like to see whoever is joined on the screen. If you can just show me, like on the Facebook or YouTube, that would be great. And then we're going to go over what we are planning to do today during. Also, there's tons of people. There's Marsha is here, Camilla's here, Jessica, hi, Raisa is here. So there's tons of people. So I want to say hi to everyone. Thank you for joining us again. So since we have a lot of people here now, so I can go ahead and start our live demonstration, which is going to be focusing on the chin and jaw contouring. So we have here our lovely Ella. She's our master esthetician and laser tech here. A lot of people know her already. So we're going to go show some before and after of like what the chin before and after look like before I go and inject her. So that is going to be our like little before and after. So if you can show me that, and kind of if you can skip, these are CoolSculpting, which we're going to talk about in a minute, but these are some chin filler videos. I want to show kind of how the whole idea of kind of focusing on the lower face and the jaw kind of seems like. So it will be a 14 slide number. So if we can start from 14. So that's another one. So these are all our patients from Golden Glow, and kindly they give us the permission to show their pictures. So I really, really appreciate, their photo releases, and so they can spread the awareness about, the procedures we do. So I'm thanking to our, patients here. So you can see, like, she has a really strong, like, upper face, very beautiful, nose, but you can see, like, how we go to the lower face, it kind of slants backwards, and kind of her profile, it does not see the justice of her eyes. So if we go and inject chin a little bit, that makes her face more balanced, looks even more pretty. And that's another person who we kind of did a little bit chin, so that you can see that how much it makes a difference on the whole face. And you can keep going to the next one. So the other way will be great. So we kind of really see there's a pretty young girl, again, very strong upper face. So this is more genetic. So the lower face, we focus on two things, as we talked about before. It can happen during time of aging. Aging is more volume loss in the upper face, and then we see some little bit of jowling. But in her case, she is more genetic. So genetically, she has very strong upper face, and not as compared to the balance, the lower face. So injecting a little bit of chin kind of enhance her profile a lot.
And looking at these pictures, I feel like such a little injection, like, it makes such a big difference. Like, I would have never thought that just adding a little bit of filler in your chin would change the structure and just the look of your face so much. Like, it looks really good.
Yeah. So this is more, we're talking about volume. And if you keep going to the next slide, we kind of go to, so this is more where we talked about chin and jaw. And we kind of talked about, like, how we can make a little bit chin and sculpt the jaw, but also we want to reduce the extra, the fullness underneath the chin. So doing a little bit cannula or cool sculpting makes a huge difference, and makes your face more balanced and kind of looks nice. So you can appreciate. In this picture, the before and after, we did a little bit of filler in the chin and the jawline, and there was a cannula done on the submental or underneath the chin. Okay, we see if you have more. So this is another to balancing a face a little bit. So we did tiny bit cheek and a little bit chin. So everybody is very, very unique. We can't have a cookie cutter approach because every face is so much unique. So we cannot just go like, okay, put 2 ml filler in everybody's chin. No, we can't do that. Or even in the chin, we have to sometimes see that it needs to project forward or go a little bit down. And the jaw angle, like, not very like strong jaw looks good on everybody's face. So we have to kind of look at the face and kind of go and balance it. So it's kind of a more 2/3, like 1/3, and it's more heart shape. It's like looks more youthful.
So if someone has good volume in the chin, but they have, like, lack of better term, a butt chin.
Yeah.
Can you fill in that line without making it look bigger?
Right. So we can. And then we, like, if you want more like pointy, more feminine chin, and that chin kind of looks maybe good in some people, like in some male patient will love that. But if you are more feminine, so we can just make it nice and pointy. So we can do with the filler that. So we can move to the next slide, please. So I'll just go with some before and after. So this is like jaw contouring, but in this we are more focusing. She already has beautiful chin and jawline, but we have some genetically, we call it submental or underneath the chin fullness. So doing the cannula on her, kind of underneath the chin, doesn't make a huge difference. She looks like another person. She looks like she has lost tons of weight. She looks great. So we can go and look at another slide. Another person, which we did a little bit of cannula underneath the chin. So it kind of does a little bit tightening too, and it kind of looks wonderful. So another to remember, the cannula dose is dependent on person to person. Who has more kind of a fat and laxity will need more amount as compared to somebody who has less. And it is dose dependent, like means if you're going to do the next treatment, your result will be kind of a better than before. Can go to the next one, please. Another candidate. So in this case, we just did underneath the chin. She would have been a good candidate for just doing the side of the face or the jaws too. But we just have to go with somebody's choice. But even doing that little bit fat kind of makes a huge difference in our profile.
So do you suggest doing more than one treatment, or is that more patient dependent?
Yeah, so it is definitely going to see better result if you're doing more than one treatment. But I try to have a like good amount in first, treatment, unless if you're not choosing to go through that swelling, bruising again. So most time, like you have 80% result in first treatment, and you kind of done. I can go to the next one, please. So this picture is like great, which we have the fullness, but not only fat, but a lot of skin, and you don't see that much of skin tightening. So with Kybella alone, and it looks like amazing for non-surgical procedure.
Yeah, that looks great.
Okay, and this is just example. We did not treat it underneath the chin, but it was for like extra little jaw. It makes you look tired and aged just right there, to kind of straighten the jawline more. So if you have a straightened jawline, you look much younger than before. And now we're coming to the like more laxity we talk about, like threads. So doing like little bit threads in the jawline, kind of how we have like a little bit laxity and kind of pulling it back tiny bit, and it kind of makes you look much younger. And we're focusing on the lower face and neck on kind of this event. So we can go to the next slide. So just like a little bit laxity underneath the chin, if you kind of go and tug back the chin a little bit with the threads, that's kind of how it looks like. And as I said, everybody's different. So not every two people have the same neck or same jawline, which we need to kind of improve or enhance. We can keep going to the next one, please. Yes, please.
Charlotte says, how long does this last?
So we're talking about Kybella.
Kybella.
So Kybella causes permanent fat loss. So whatever you're gone is gone. So Kybella is a medicine in which we inject, and it is binding with your tissue, and then your body gets rid of it in like 3 months or so. So what you see, this is not that you have to do like Botox every 3 months. So you can still gain weight, lose weight, but gaining weight is going to be gaining weight overall. But in that area, what fat is gone is gone. So it is more permanent, we'll say. Okay, do you have any other questions?
No.
Okay.
Karen says, love watching you work your magic.
Oh, thank you, Karen. So yeah, in between, if you have any questions or comments, please let me know. That's amazing. I love your guys' input. So please keep sending that. If you have any question, please don't hesitate to ask us now. And if you're not able to get back to you right now, we will definitely, you can call us, you can email you back. We can also email you all the specials we are running. You can always feel free to call us. Our phone number is 727-683-0894, and it should be on there too. We are here to take your phone calls. You can also schedule a consult with us if you have any questions like, hey, I saw this, it looks fine, but if I am the candidate or not, you want to find out, we do complimentary one-to-one consultation. We'll be more than happy to book for you. I'll be more than happy to meet you and go over one by one what the options are and which fits your lifestyle, your downtime, your budget, because we have a lot of options.
Yeah, that's what I really like about the special that we have going on is there are so many options to kind of create the same sort of outcome.
Yes.
So it's really made for anyone. So most people will be candidates for all of this. So if you're curious or whatever, just give us a call and we'd be happy to answer any of your questions about it.
Yes. So if you can go over the slide real quick about the spatials, which we have like those like 4 balloon thing, if you see. Yeah. So we can see this is like 4th slide. So we can go over that if somebody's interested. The next one.
And with the threads as well, I always like to mention this just because I think it's amazing too. With the threads, here we do what we call Dr. Mira's signature thread lift. And the reason that we call it that is because a lot of people wonder, well, how many threads will I need? And here, Dr. Mira doesn't really like to focus on the threads. We like to focus what's going to give you the best natural result. So the threads don't matter. So that's why we always do it by area. So I just think that's really special, and I think that's great. I think it's unique to every person. So that's why we always call it Dr. Mira's signature thread lift.
Thank you.
You're
So it is
welcome.
just the thing. We do use a silver insta lift. We
Yeah.
use PDO threads. We use like different kind of threads because everybody has its advantages and disadvantages. Some threads can do heavy lifting, but small areas with the small threads kind of do their magic. So we combine all of them. And if you need like one thread or 100 threads, it's not anybody's problem. We just want to give optimal results. So that's why we go by area.
Yeah.
So it's like upper face, lower face, neck, and some people want brow lift. So that's our areas are. So if you want some more lift, like here, I'm going to Ella face here because she's our lovely model today. So you can put your face back. And she had done like some threads. We just did the upper face. So we did silver and lift, but that's kind of a, we have to repeat it like 1.5 and 2 years from now. So that's for more laxity that we like threads come in. And then we're going to focus today and inject more on the chin and jawline. So when you see the Ella's like proportion wise, like from here to here, you can see she has beautiful eyes, very like strong nose, but here we see like tiny bit kind of a laxity, and we're just going to wipe if there's numbing cream over there, and then we are going to like talk like here. If we kind of inject a little bit like filler here, it's going to make her jawline like more straight. So I'm going to like a little bit before pictures on our quick iPad, so Amanda can do that pictures for me, and then we can go over, and then we can go ahead and start our injection.
How do you sit straight up?
All right, Ella. So I want you to sit straight.
Okay.
So Amanda, what she's doing here, so we kind of are taking right before pictures. So it's a good input to show that how much we got improvement right before and after. And so we take quick pictures, we take quick picture right after, and then I'm going to do some markings and going to really assess how much filler wear is going to look on Ella's face. So if you see in this, like we want to like really focus on this area to make it more enhanced. So this is my markings right here. I'm just going to go move around her. So today product I'm using is called Voluma. It's a great product for contouring of cheeks, jawline, chin, and it's made of hyaluronic acid, which is the product we normally have in our skin, and then it's like cross-linked to kind of last a little bit longer, made by company Allergan, which makes the same product, Botox. So sometimes who has like a more strong chin, we call like orange peel chin, when you close your mouth and it's like puckered a lot. So we sometimes do smooth with a little bit of like Botox right here. This muscle is called mentalis, and if it's really strong, it makes like puckering of the chin. So we kind of smooth that sometimes. So if you want to see like right here, we want to like make it as sharp as possible. So we're going to go ahead and inject. If you have any questions, anything, please let me know.
You like it?
So we want your legs up. Yeah, we want our patient as comfortable as possible. Okay. So I also gently will kind of do my injection right here. So injection does not take that long. It is more like talking and going over, making a plan, takes more time.
How you doing, Ella?
Perfect.
Good.
So we do like little topical numbing, and then we are injecting with our needle today, because in some areas we use needle and some areas we do use cannula. So it is just like to make it look perfect. So we want to just press and mold it tiny bit. So even just so, this is 1 ml. 1 ml is not a like huge amount, but even that amount you can see her side kind of looking straight already, as compared to if you want to see that side. So if you want to turn your face other way, Ella, and show like right here, this area, and compared to kind of right here. Beautiful. So kind of just tiny bit pinch. Looks good. Beautiful. So
Grace is asking how long does filler last?
so the filler in upper face lasts up to 2 years. In lower face, it can last up to a year, year and a half. Everybody's different. Some people kind of metabolize the filler more than other. So this is our one side done. Right. So I'm going to just kind of do one side first to see. I'm going to turn your face that way so I can see right here. You're going to feel a little pinch again.
And don't forget, you guys, if you guys have any questions, feel free to put them in the comments. We will answer them as soon as we see them. If you have any questions on the specials or the raffle, there is a raffle going on right now. Every $500 that you spend towards a special, you will get a raffle ticket. If you are a VIP, you will be getting 2 raffle tickets. And we'll go over everything that is in the raffle just in a little bit after this injection, so that you guys can see it on the screen, so that it's easier to see. But we are doing another raffle, and the value is $4,000. So it's another amazing raffle.
Yeah. So you can see how our looking a lovely jawline. How are you feeling, Ella?
Great, thank you.
So if you can see, of course, you're going to see like a little bit of irritation because we're just doing injection. Or you can see, you know, the jawline.
Even underneath, you can see.
Yeah, right here, like straight right here, and as compared to the other side.
Mm-hmm.
All right, right here. So yeah, a little pressure will be nice. We're gonna go inject our little volume and making the jawline really sharp looking. So this is for like end of this month, I think we're giving 1 week. We're
Yes.
going to do this filler is we can do kind of a buy 2 get 1 free.
Yes, so this filler right now is buy 2 get 1 free, which is a really good deal. So dependent on, you can do this filler all over your face, tear troughs, cheeks, temples, nasolabial folds, marionette lines,
And
lips.
they can, mix and match.
Yes,
So
yeah,
that's
you
another
can mix
thing.
and match. You can always bank them if you know you're going to need them in the future, or if you want to try a new area, anything like that. So super good deals going on right now that you guys definitely should take advantage of.
Beautiful, beautiful.
You are doing great, Miss Ella.
So our goal here to maybe like, if you look at pictures before and after on our website, we have very, very natural looking result. We just want to enhance your own unique features because we are so different and we don't want to change that a lot, but we just want to enhance that a little bit. That's our goal here always.
Enhancements are never bad.
No. And also guys, like one side can be different than other. So Ella has like maybe everybody's like one side is always better than other side. So one side come like easy to have less volume loss. One side is higher than other. So yeah, that's it. So I will do a little pressure and then I will have Ella to be judge of the work. And then and we're going to say after pictures, and sometimes you take after pictures and you can see the difference right away. So a little bit aftercare about the filler, guys. So filler is like we suggest is a gel, like transparent gel. We inject underneath your skin on different levels depending upon what we're trying to achieve, and you can feel the filler for a couple of weeks because we just injected it there when you wash your face, and that's okay. And after a couple of weeks it becomes part of your skin and you don't feel it anymore. The swelling and bruising is definitely a part of the filler recovery process. The swelling comes in next 24 to 48 hours. Everybody's different. Some people swell a lot than other, and then after the swelling goes down quickly. We want you to like wash your hands before you're touching the area, and we want to avoid makeup, any strenuous exercise, and just ice a lot. Ice makes a huge difference in the recovery.
48 hours.
Yes, 24 hours is like where it's kind of a more how much you can tolerate. So look in the mirror, and this is a big reveal. What do you think?
Ooh. So different.
Yeah, is it different, good different, or bad different?
Different, of course. Yeah, it's very hard to smile because I can feel pressure.
Yes, because you have like lidocaine. There's a lidocaine in the filler, so you feel like heavy, more like you don't look any different anymore, but you look fine, but you feel like a heaviness or
Yes,
like you're
that's right,
have tons
yeah.
of weight on your face.
Oh yeah.
Yeah, but
No, I can see difference.
right. So we're gonna take your after pictures,
Yeah.
and then
Thank you so much.
yeah.
And our doctor, she has such a gentle touch. Yeah, she's great. Thank you.
Yeah. So now she's saying she feel comfortable, like I'm done poking her. So yeah.
Should I massage after?
So you want to feel a little bit puffy there. You can massage tiny bit, but it's like when a couple of hours later there's a fibroblast or skin tissue kind of goes into the filler, and massaging doesn't help much. It's just kind of a you increase the chances of like completely don't have to, but you can see how beautiful now you see the jawline looks. We don't see those like dips here anymore that much, and looks nice. Like here, if you sit straight, you can see. And how you said that this side was like worse where we injected first as compared to this side. This side is like completely straight now. And so this side sometimes we do touch-ups. We need touch-ups, but and this side can a little bit swell more too, because if you go more injections on one side can swell more. So please don't judge your face tomorrow after 24 hours. The swelling is never symmetrical, so your face can look asymmetrical. It's fine. It's just temporary. It'll go away.
Yeah.
Okay. So any questions from our lovely audience or anything? We'll be more than happy to. And we are taking just little after pictures. So Annie, what do you think? What will you like on elastin wise? What do you recommend after filler?
Well, I would recommend the restorative skin complex because it's a great complement to people who want a little more facial volume. Not only does it stimulate collagen and elastin, but it also plumps up the adipocytes, or the little fat cells in the face, so you look a little more supple and plump and volumized.
Right.
And so it's a great complement.
Right. So we are doing some correction here, but it is always like you don't just go gym one day and get your perfect body. It's more combination of like injections and lasers and the skincare. I cannot emphasize enough that how important is the skincare, how you maintaining your skin. Definitely it comes in a important role in that.
Exactly. I always kind of liken it to going to the dentist and getting your teeth cleaned, but not brushing in between.
Yeah.
So you really have to pair your work at home. You have to invest in it as well, and really help to support what the doctor does in the office.
Yeah, absolutely. Thank you so much.
Thank you.
Right. So if you have any questions about elastin from our rep, please go ahead and ask us. We're going to go over, we have a couple of minutes, like 10-15 minutes. So Ella does amazing job. She does Hydrafacial, so she's an expert, a guru in skincare. So come see her. She does amazing job in Hydrafacial. She's a kind of a laser tech too. A lot of people kind of know her already, but let's compare her before and after on iPad and see.
Absolutely.
Let's see Ella. So Ella's husband said that if Ella comes too much different, he cannot enter the house. I said, oh my God, Ella, I'm going to like completely change you. After this injection, you not look Ella anymore. So, so guys, you think like
A lot of people say it looks great.
Yeah.
Thank you.
So, thank you, Marcel. Jessica is here, so that's wonderful. So if you like look at here, if you can like focus, I don't know if you can see like right here as compared to here, like whole like a little bit chin and doing like the dip right here. We can straighten the jawline right here.
The jawline looks so much more cohesive and just
You see the
straight.
difference, like how it looks. This is your before and after right here.
Wow.
So this is your lower face now. You can see your chin right here and like right this area. And of course, this looks a little bit irritated right now. We just injected you.
It's normal.
Yeah. And then you see how this like jawline is coming all straight now. So I want to focus on like people if they can
Very
see
great,
right here. Like so you can see like right here the dip, and then this chin, like a little bit stronger chin, and right here is coming more like straight now. And of course we can go improve a little bit more, but we have to be kind of a conservative here, and Ella is like more natural beauty. We want to restore that. So
Dr. Mira, what do you think? Later, can I see more results?
So this is like you will see tomorrow. This is going to be more like I will say swelling, and then we settle down, you will see less irritation, and then it will settle down and more. But if you like swelling, that means you will need more filler. Some people say, oh, I like when my lips were like swollen. That means that if they love swelling, that means, and some people think like, oh my God, I was great next day, and now 2 weeks later, all my filler is gone. I have nothing left. So they were just enjoying swelling. So in 2 weeks, what you get, that's what are you going to look like, and then we take it from there. You can have like a little bit more like chin. We can still use, because you're like, as I said, non is like really nice and strong, and then we can have like a little bit more chin if you wanted to, but I just wanted to be like more conservative side. Okay, so that is great. We can have this. We can answer questions. So Barbara Cushing is saying, can't wait to see Ella next month. I'm reading
Karen
this
says it
question.
looks fantastic.
Right, thank you so much.
Thank you, ladies. Thank
Can I
you.
ask a question?
Yes, go ahead.
I'm thinking like the
Yeah,
audience.
come in the camera. Yeah, join the party.
Do you ever do a combination on the same day when someone comes in, do threads and a little bit of filler to kind of mold and sculpt?
We do. So we do that a lot. We do Botox in the upper face, which we're relaxing the lines here. We do like threads for the upper face. And even in the lower face, we do threads here because entry point is on the side and it's taking care of the laxity. And then in the marinette lines and chin and nasolabial fold. So filler, guys, is more in the lower, like in the middle of the face right here, like underneath the eyes, nasolabial folds, like here. Even we pull our skin back, even we have facelift or thread lift, this volume loss area has to be replaced by volume. Is it our filler or fat? Or things like that, and we have to take care of our skin with some kind of a corrective treatments like lasers and skincare. So we do actually IPL, fillers, Botox at the same time, because some people want a lot of downtime at one time only. They don't have time to come every week and have like, okay, now I'm going to be puffy for my fillers, and then I'm going to be puffy for my thread. So they want to just do everything together. So yes, we can. But thank you for the question. It was like great question. Yeah. So, all right. So we're going to go our wonderful the raffle. This is a big raffle, and we want to show what we have in the raffle. It is like around $4,000.
4,000. Yeah, actually, I'm gonna steal that so everyone can hear me. Yeah. So the raffle right now, you guys, up to around a $4,000 value. So you're getting Radius, which is a type of filler, which is really good for the areas that we're talking about for our cheeks, jawline, chin. I feel like Radius does a good job at replicating kind of like bone structure almost.
Yes,
So
it's a grinded calcium, so it kind of goes deep, and some people like Radius better versus Voluma. We just have to have all the options here.
Yeah, patient
but
dependent.
yes, absolutely.
So then we also have Jeuveau in our raffle, which is another toxin. So it's similar to Botox or your Xeomin, Dysport. We have one microneedling, which is awesome for the skin as well.
Yeah.
It's going to help boost the collagen, stimulate circulation, helps with scarring, pore size, all of the above. It's a really good kind of preventative and good
the boost to the collagen is called
exactly.
CIT.
Thank you.
Collagen in his induction therapy. Yeah,
exactly. You also have Thermiva in there, which is vaginal rejuvenation. Then we have Thermi Body, which is also radio frequency. The Thermi family is what I like to call it.
Yes.
So Thermi Body, radio frequency to help tighten the skin, helps with collagen, elastin boost. A lot of people like to do it on thighs, stomach, arms. Really helps kind of smooth out any cellulite and things like that. So that's a really good treatment. And then we are also making a skincare bundle for you guys.
Yeah, so I will let Annie actually show that with the amazing like raffle she's doing, and she's going to go over and see what she has in it. Yeah.
So we have this wonderful little kit that has a regenerating skin nectar for pre and post procedure, and then also the restorative skin complex that I mentioned, which is a great anti-aging product that's a great complement for people who want a little more plumpness and suppleness to their skin. This can fit great with some of the procedures that she just mentioned. So you could start pre-treating, really prep that skin, prep that canvas to get a really good result from your procedure. And then it'll help you heal quicker and then help to maintain those results.
That's great. So this is lovely box. That's our, thanks to Annie. Yeah, right. You're wonderful. Yeah, I really like the this product line. Yeah. Okay, so that's that. But thank you so much, Annie. And so any questions about Annie, or we are happy to, as I said before, answer. And we have our Ella here. She's actually who does the micro needling, and I want to go over a little bit about cool sculpting. I'll show some before and after of the cool sculpting, which I kind of didn't go over. So it's a really great treatment, which is non-invasive, which is kind of doesn't have any downtime. You can work on the stubborn body fat area. And of course, the chin is one of them. And I have to have a big announcement, guys, that we are going to get Elite. Also, a couple of weeks from now. So what Elite is, it's their brand new system for cool sculpting machines. Yes. So Elite gives better results and treat more area in their suction cup. So they kind of revamped everything. So it was giving like 20-25 reduction, permanent reduction on those stubborn areas, like underneath the chin, bra fat, your arms, legs, abdomen, your so you can pinches, guys, you can sculpt it.
Yes.
So we can, this is like a flanks, we're showing some nice results. This is not for weight loss, but some people have the stubborn little fat which you cannot get rid of no matter how much you exercise, how much you diet. So if you keep going on the other areas, this is just after like 2 sessions, and have a great result on her lower abdomen. She is like busy mom. She doesn't have any downtime for surgeries or anything. She just want to come here, spend here a couple of hours, go back to her routine. So that's the kind of result. So that like clothes fit better, like you're wearing Spanx. So this is great result after. And if you keep moving, another abdomen, the abdomen looked like more toned and more shape, like she has done like 1,000 sit-ups.
And this is after one treatment as well.
After one.
Yes, this one is after one.
That's amazing.
So her results were really good.
And okay, and then next one. So this is great. What it was talking about, the alternative underneath the chin to kind of freeze that extra fat and skin underneath the chin. So jawline looks more nice and sculpted, more younger. And of course, that's another jawline and chin. You can see the huge difference in her jawline looks much younger. She just got one treatment, and it's like 3 months after just one section. Yeah, it looks really great. And another abdomen, you can see like our abdomen looks so much flat, like on the front of the abdomen. There's good bulk reduction there.
And it's what I like about this treatment is you definitely see a difference after one treatment, but I feel like you get hooked after, because it really works. It's crazy. I did my lower abdomen and I'm like in shock. I like can't wait to do more. But it really works. And kind of the way that I describe this treatment to people, to just it's kind of hard sometimes to kind of understand. So it's definitely not a weight loss treatment, but it helps with volume. So you want to think more along the lines of, you can see in this before and after that it really treated the volume. So I look at it in cotton balls, right? So cotton balls and subcutaneous fat, they don't really weigh anything, but when we're doing this treatment, we're getting rid of that volume. So you're taking, cotton balls out of a bag, and it's going to lower that volume. So you can see this girl here, this is after this is 1 month after her second treatment. And you can already see such a good result. And we still have 2 more months to go to see, her final result.
Yeah, it is just, she's so active.
Yes.
She's perfectly fit, but she has little stubborn lower abdominal fat that she's struggling to get rid of. So that's the kind of a thing. We also have to encourage the healthy diet, exercise. That's not a replacement for that. And with the new machine, Elite, our results going to be much faster, much quicker.
Yep.
And we can treat up to 4 areas at the same time.
Yes.
That's amazing.
Yeah, so it's going to cut the time. It's going to cut the time in half. It's going to be great. I'm so excited for the new machine. It's going to be great. So Jamie's asking, how long will the specials go for? The specials are going until the 30th of June, and then we will be announcing our raffle winner July 1st. We're
Right.
gonna be picking
So
the
we
winner.
are like all 4 areas which we talked about: cool sculpting, Kybella, fillers, and the threads. All 4 things are on special right now, guys. So yeah, if you have any question, please give us a call, and we can show them one more time. Then get the chance to look at them. That's our like special slide on that.
And then with the specials, you guys, how you get entered into the raffle, just to reiterate, so every $500 that you spend towards the specials, you will be getting 1 raffle ticket. If you're VIP, you'll be getting 2 raffle tickets into the raffle. And so these are our specials up there. Again, buy 2 vials, get 1 vial free of Kybella. Threads, buy 1 area, get another 1 free. Cool sculpting, buy 4 cycles, receive 2 free. And then any Juvederm filler, you're going to buy 2 and get the 3rd free.
Okay, that sounds great. So that kind of concludes. So we are going to do our raffle on 1st of July.
Yes.
So we have enough time to kind of think about it. If you want to take advantage of these facials, if you have any question, you want to come and say hi to Ella tomorrow. So you can look how she looks tomorrow. She's here to answer all your questions. So yeah, we are going to be kind of waiting, and then I hope you enjoyed. I thank you again for kind of joining us for your kind of the receiving the $50.
Yes.
You're going to put in an account. Give us a couple of days, guys, because the girl's going to go through all who have kind of tuned in today and going to look into the account. So they're going to put in their
so if you're
account.
watching now and you didn't comment saying hi or that you're here, make sure you comment right now, because that's how we know
that you were here.
that you were here, so that we can put your $50 gift card into your account.
Yeah. So yeah, I thank you again, everyone. Thank you for tuning in. And hopefully we love like online events. I think you can watch us like in comfort of your home, if you're wearing PJs, everywhere. So that's great. We're going to be doing a couple of more, but hopefully, next time we can do some in-house event too. That'll be great. Okay.
All right, guys. So thank you so much for watching. If you have any questions, please remember, call us, email us, you can text us, whatever works, and we will get to you as soon as we can. And then don't forget to book a consultation if you have any questions or concerns about anything. We'll help you guys with anything that you need.